Are COVID-19 vaccines potentially harmful or even deadly? It's a sensitive question that's certainly not unique to Korea.
But since this country started its own vaccination program last week, several deaths have come under the spotlight.
First, 2 deaths on Wednesday, within hours to days of the deceased receiving vaccines. Korea Disease Control and Prevention Agency Commissioner Jung Eun-kyeong responded by stressing the safety and importance of these vaccines. Over 200 million doses of the vaccines have been administered globally, and although several deaths were reported among the vaccine takers, none of them was found to be a result of a vaccine, she insisted. Then, 3 more deaths were confirmed a day later, including a woman in her 20s. These 5 people who died had all received the AstraZeneca vaccine, and all of them were patients under 65 at long-term care facilities, considered a priority group, and investigations underway into their deaths.
Of course, ordinary members of the public may be afraid after seeing the deaths after vaccine headlines.
But if we read further, there's a global consensus on the safety of these vaccines. For instance, Robert H. Schmerling, MD of Harvard Health Publishing, lays it out like this. The information we have about the effectiveness and safety of COVID-19 vaccinations is encouraging. Minor side effects should be expected. Severe allergic reactions may rarely occur. Side effects from the vaccine are not reasons for most people to avoid vaccination. And South Korean President Jae-in seems convinced. His staff have been keen to point out he's willing and most likely to receive 2 doses of the AstraZeneca vaccine before going to the UK for June's G7 summit, because the Pfizer alternative's currently being given to medical workers. As President Moon's 68, that would be an endorsement for a vaccine that's been scrutinized over whether it should be given to the over 65s.
The president's hardly the only one willing to be vaccinated here either.
More than 225,000 people in South Korea have received jabs over the past 8 days, mostly the AstraZeneca offering. And of those, just 0.7% have reported side effects, a tiny fraction being possible allergic reactions. It's natural to be cautious, especially when daily COVID-19 deaths here have been in single digits. As with many aspects of the pandemic, this is a battle for transparency and trust, but also for remembering the concerns of the most vulnerable.